Now we're going to get into the functional areas of the cerebral cortex and connect them to the function, blood supply, and lesion finding. So first and foremost, if I take the brain and divide it into two halves, two cerebral hemispheres using the longitudinal fissure, we're going to have one cerebral hemisphere here, right? So this is the cerebral hemisphere, this is the cerebellum, and this is the brainstem. And we're viewing the brain from the lateral side. So if I'm standing upright, someone is viewing this picture, this brain, by standing either on my right side or left side. So this is a lateral view of the brain, right? So superiorly and laterally, you can view the central sulcus here. The central sulcus separates this frontal lobe from the parietal lobe behind. And then we have another horizontal fissure, which is called the Sylvian fissure. The Sylvian fissure separates the temporal lobe from the parietal lobe and frontal lobe superiorly. And then the central sulcus. Anterior to the central sulcus, you have the primary motor cortex, and posterior to the central sulcus, you have the primary somatosensory cortex. What is the primary motor cortex and primary somatosensory cortex? These are the areas where all your ascending tracts were basically ending. So you remember the corticospinal tract was ending in the primary motor cortex, and your dorsal column medium lemniscus pathway was ending in the primary somatosensory cortex. So this is the end point of those ascending pathways, if you can remember. Ascending and descending, however you want to put it. So corticospinal is ascending, but dorsal column medium lemniscus is ascending. Now, you can see the somatosensory association cortex also here. So frontal lobe, if I take the lobes one by one, the frontal lobe is more associated with thinking, planning, moving, and speaking, right? So you have the frontal eye field here, you have the premotor cortex here. This is the Broca's area here. We'll come back to it later. And the Wernicke's area is in the temporal lobe, and the Broca's area is in the frontal lobe. These both areas are connected by association fibers. We call that the arcuate fasciculus. The arcuate fasciculus are fibers that connect the Broca area with the Wernicke area. The parietal lobe itself, okay, so this parietal lobe has the feeling and interpretation sensation. Since you have the feeling and interpretation sensation, you have the somatosensory association cortex here and the primary somatosensory cortex here. Okay. And then, okay, if you want to understand the model of the brain more, there's a YouTube video on the brain model. I've taken the entire model and shown you exactly where these areas are. It will be more helpful for you to view that video first and then come back to this area. Otherwise, it will be difficult to understand where those exact areas are located. And then we have the occipital lobe. The occipital lobe, by its name, basically is responsible for the vision. So you have the primary visual cortex here, and the temporal lobe is here. You have the limbic association area here, and your primary auditory cortex here. So temporal lobe has more to do with hearing and understanding language because the Wernicke area is here, and also a bit about the memory, right? Now, moving on to um, let me do this a bit more in detail. So the prefrontal cortex, can you see this green, light green, sea green area here? The prefrontal cortex is basically the CEO of the brain. And damage to the prefrontal cortex causes poor judgment, disinhibition, personality changes, and emotional instability. So, a classic example is of Phineas Gage. So, if I give you an example, after his frontal lobe injury, his personality changed dramatically. So, personality is basically related to the prefrontal cortex. And the blood supply for the I'm going to touch the blood supply here because I'm doing the blood supply while I'm explaining the cerebral cortex areas because it's going to be helpful for you to connect the locations of these of the brain regions to the blood supply because they're always connected. Because whenever you get questions, you get them like you get a stroke and you're supposed to identify the area damaged and you're supposed to identify the artery damage. It's always located with one another. So when we talk about this prefrontal cortex, the blood supply mainly comes from the anterior cerebral artery and the middle cerebral artery. So the medial portion, nearer the medial part, is supplied by the anterior cerebral artery. And when you come to the lateral part, this lateral portion is supplied to the middle cerebral artery. Then we have the frontal eye field area. This frontal eye field area of the frontal lobe, this controls voluntary eye movement. It makes both eyes look toward the opposite side. Example, the left frontal eye field, the right eyes move. And when the right frontal eyes field is activated, the left eye moves. So it basically it makes both eyes look towards the opposite side. So a lesion here in the frontal eye field, the eyes deviate. If there's a lesion here, the eyes deviate toward the lesion. Example, if there's a left middle cerebral artery stroke, the eyes will look on the left, right? Because the right one is not working. The blood supply of the frontal eye field of the frontal lobe is mostly middle cerebral artery. Then we have the premotor cortex area. The premotor cortex area is basically this pinkish shaded area in the frontal lobe. The premotor cortex area is anterior to the primary motor cortex, which is also part of the frontal lobe. And this premotor cortex area, the pink area, is related to the motor planning. It decides what movement should I make before the motor cortex executes it. So a lesion of the premotor cortex, a lesion of this pink area, the patient understands the task but cannot perform learned movement. Example, the patient cannot pretend to brush teeth despite having normal strength because this is a preformed learned movement, right? That's your premotor cortex. Now, blood supply to the premotor cortex is mostly the middle cerebral artery. So you see how this lateral region, this area, and this area is mostly the middle cerebral artery, right? Now, the primary motor cortex. The primary motor cortex initiates voluntary movement. So, the corticospinal tract was starting from here. The corticospinal tract starts from the precentral gyrus. It's all this area is also called the precentral gyrus because it's just in front of the central sulcus. So that's why it's also called the precentral gyrus. It initiates voluntary movement and it controls the motor homunculus. The motor homunculus are basically the motor and sensory homunculus are basically these regions of the brain. The primary somatosensory cortex is the sensory homunculus, and the primary motor cortex is the motor homunculus. Let's go here and try to understand what I'm saying. So um, if I take a mid section of the brain, right, from right lateral to left lateral, if I cut the brain open, right, and I try to view it so basically, this is the frontal lobe area, and this is the temporal lobe area, and this is the inferior surface of the brain area, right? So I can see that there's a motor homunculus here and there's a sensory homunculus here. What are these motor homunculuses and sensory homunculuses? They basically show you which areas are donated by which parts of the brain. So this is the pre-central gyrus and this is the post-central gyrus. And in between was the central sulcus, right? Let me go back and show it to you here. So this is the central sulcus and this is the primary motor cortex where the corticospinal tracts were starting from. And just behind the central sulcus is the primary motor somatosensory cortex, which we were also calling the post-central gyrus, right? So these two areas are depicted here. So the motor homunculus, this pre-central gyrus is in front of the central sulcus, and the sensory homunculus, the post-central sulcus, is posterior to the central sulcus. Now, the motor homunculus, let's see how the brain connects it. Now, look at this. The most medial part is the toes. Then we have the ankle, knee, hip, trunk. Then shoulder, elbow, wrist, hand, little ring, middle, index fingers, thumb, neck, brow, eyelid and eyeball, lips, jaw, tongue, swallowing. So if you go from medial all the way to the lateral, you see that initially the toes, ankle, knee, hip, and trunk are supplied by the anterior cerebral artery, and then the rest of all of it is supplied by the middle cerebral artery, right? Similarly, for the sensory homunculus, this is where your ascending tracts were ending, right? So you can see that the genitals, foot, toes, legs, hip, and trunk are supplied by the anterior cerebral artery, and the rest of the entire sensory homunculus is supplied by the middle cerebral artery. So if you, for example, have a lesion for example, you have the left motor cortex lesion, right? So this is the motor cortex, and the left motor cortex lesion happens. So what will happen? You will have contralateral weakness. There will be right-sided weakness. And depending on which area is weak, are the hand, little fingers, and ring areas weak, or is the trunk, hip, or knee weak? Depending on that area, we can locate if the anterior cerebral artery stroke is happening or the middle cerebral artery stroke is happening, right? So if you have a leg trunk or leg trunk or knee area, then you know that the anterior cerebral artery stroke is happening. But if you have the hand and face area happening, then you know that the middle cerebral artery is infarcted, right? So this is how we try to connect the areas of the brain to their lesion. So the primary somatosensory cortex behind the procentral gyrus behind the central sulcus, you have these areas that receive the touch, pain, vibration, proprioception, and temperature, right? These areas end here. So it basically, what does this area do? It basically brings all the sensations from the ascending tracts. There's a from here also there's a contra, if there is a lesion here, the patient cannot localize touch in these areas properly, depending on which area is damaged, and there will be contralateral sensory loss. Okay. Now we come to the blood supply. Again, the leg area is supplied by the anterior cerebral artery, and the arm and face area in the sensory homunculus is supplied by the um, middle cerebral artery. Okay. Coming back here, the somatosensory association cortex. This is the posterior parietal lobe. When we come posteriorly here, now the parietal lobe starts after the central sulcus. As soon as the central sulcus comes, now this primary somatosensory cortex, or what we were calling the postcentral gyrus, is part of the parietal lobe. The parietal lobe also has a somatosensory association cortex, and this is basically part of the posterior parietal lobe. And the function is it interprets sensory information. The primary cortex receives sensation, and the association cortex answers, what am I touching? So the information is coming to the primary somatosensory area, but the somatosensory association area receives that sensation and interprets it. So it tells you what you are touching. Now, there's a lesion where we call it astereognosis. The patient can feel an object, but they cannot identify it because their somatosensory association cortex is not working properly. The patient can feel an object, but they cannot identify it. They can feel a key, but they can't recognize that this is a key. And the blood supply supplying this association cortex is basically middle cerebral artery. Then we have the Broca's area. The Broca area is very important and it's very often tested. This is speech production, and it's uh, it's usually present in the dominant hemisphere, usually on the left frontal lobe. It is related to speech production and it creates a motor program for speaking. So a lesion here, we call it the Broca aphasia. The patient understands the language, but the patient cannot speak fluently. Example, he will be like, I want water, and the blood supply is from the middle cerebral artery superior division in the Broca's area. So Broca's aphasia is basically comprehension is normal. The patient understands, but the speech is non-fluent. The patient knows answers, but words cannot get out. On the other hand, the Wernicke area and Wernicke aphasia is different. The Wernicke area is present in the dominant temporal lobe, and the function is basically understanding, comprehending language. It allows understanding of spoken and written language. The lesion here is called the Wernicke aphasia. The speech is fluent, but it's meaningless. Example, the patient will say, the dog flew the refrigerator yesterday. The patient doesn't realize that the speech is abnormal. And this is supplied by the middle cerebral artery inferior division. So the Broca is supplied by the middle cerebral artery superior division, and the Wernicke is supplied by middle cerebral artery inferior division. So Wernicke aphasia, remember that the speech is fluent, but the meaning is absent. Comprehension is poor. Then I told you that the arcuate fasciculus connects the Broca's area with the Wernicke areas. It's a fiber tract that connects the Broca's area with the Wernicke area. The function is to transfer the language information. If a lesion happens of the arcuate fasciculus, then what will happen? There is conduction aphasia. There's no conduction going on. Patient can understand language. Patient can speak fluently, but patient cannot repeat phrases. He cannot repeat phrases because there is no conduction. So example, doctor will say repeat no ifs and or buts. So patient will say no ifs, no He will stop in the middle because he cannot repeat. And the blood supply is usually the middle cerebral artery territory here. Then we have the primary auditory cortex. This primary auditory cortex is part of the superior temporal gyrus, right? So the temporal lobe has three gyruses: superior temporal gyrus, middle temporal gyrus, and the inferior temporal gyrus. These are the three gyruses of the temporal lobe. If you want to understand better, go and see my brain model. It will be very helpful for you to understand this. Now, the primary auditory cortex is part of the superior temporal gyrus. It receives hearing information. A lesion in the primary auditory cortex, usually you get mild hearing deficits because both ears project bilaterally. So even one-sided lesion, the other one will compensate and you will hear something, right? The blood supply is again middle cerebral artery. Then temporal lobe, overall, the temporal lobe function is memory, language, and hearing. It contains the hippocampus and amygdala. You know that the hippocampus and amygdala are responsible for memory also and emotions, fear, and aggression also. Blood supply is the middle cerebral artery. But the inferior temporal lobe regions, the blood supply is posterior cerebral artery. So as you're coming laterally and inferiorly, you're moving from the middle cerebral arteries supply towards the posterior cerebral artery. Then you have the primary visual cortex in the occipital lobe. This receives visual input by its name. And the blood supply is again, since you're coming on the inferior side, it's posterior cerebral artery. Now remember that the lesion in the contralateral side will, a lesion in the primary visual cortex will lead to contralateral homonymous hemianopia. Example, you get a right posterior coronary artery infarct, but actually you'll get a left visual field loss. Okay? So that is something you should know, and these things are very tested. I'll stop the video here, it's getting too long, and I'll start from the blood supply in the next picture, the proper blood supply picture.